to Downing Street for today's coronavirus briefing. I'm joined by Dr. Susan Hopkins from Public Health England and NHS Test and Trace. And today I've got an update on progress in our battle against coronavirus, some new evidence of the effectiveness of the vaccines, an update on cases of the Brazilian variant of concern, and extra funding to support mental health in schools. Because, of course, on Monday, that marks our first step in the opening up after this lockdown. Next week, classrooms will once again be buzzing with activity. And I know that parents across England will be delighted and I'm sure relieved that all children are going back to school. Also from Monday, I'm just so pleased that we're able to reopen care homes to visiting. We've put in place a really careful policy so each care home resident will be able to register a single regular visitor who'll be tested and wear PPE, but be able to visit. And I know that this means so much to hundreds of thousands of people with a loved one in a care home and to those who live in care homes. And I'm really, really glad that we're able to make this step. So first, let's turn to the latest coronavirus data. And this data shows the progress we've made, including more evidence on the impact of the vaccine in saving lives. If I could have the first slide, please. Here you can see the number of cases of COVID-19. And I'm pleased to say that the cases are still falling. The average daily number of cases is 6,685, the lowest since late September. And the weekly case rate across the UK is now 84 per 100,000 people. The latest figures from the Office for National Statistics that were published earlier today report a further significant decline. They show that in England, 1 in 220 people have coronavirus, a fall from 1 in 145 last week. This is all encouraging news, and it should give us confidence that we can safely take the steps that we're taking on Monday. Next slide, please. Slide 2 shows the hospital admissions with COVID, and it shows that they are falling too. There are still 12,136 people in hospital in the UK with COVID. That's still too high. But the average number of new admissions to hospital is 900, the lowest since October. Next slide, please. Thankfully, the number of deaths with COVID are also declining steeply. The average number of deaths per day is 248, also the lowest since October. And here the decline is in fact accelerating. The halving time of the number of deaths has come down from 19 days, so the number of deaths each day halving every 19 days last month, to halving every 11 days now. Not only that, there are now fewer people dying from all causes in care homes than is normal for this time of year. Taken together, these 3 slides show that we're heading in the right direction, although that there is further to go. And what we can also see in the data across the whole UK is that the vaccine programme is working to protect the NHS and saving lives. If we go on to the next slide, the best way to see this is by looking at how fast cases, hospital admissions, and deaths are falling. The number of cases have been falling in a fairly even way since around the middle of January, and by a quarter every week, and just a little bit more in the last few days. It's not been completely smooth, as you can see from the slide. A week ago, we stood here, and we said that we were worried that the fall in cases was slowing down. Thankfully, as you can see in the chart, that now looks more like a temporary blip, which is good news for us all. Next slide, please. Now let's turn to the number of hospital admissions. Again, this is falling steadily at just under 30% every week. But there are signs that this fall is getting a bit faster, as you can see from the last week's data there. And in fact, the 29% fall in the last week is the fastest fall in hospital admissions at any point in the entire pandemic. If we go to the final slide, please. Where you can really see the effect of the vaccine is in the fall in the number of deaths. The number of deaths is falling faster and faster. And now deaths are falling by over a third each week. And in fact, in the last week, have fallen by 41%. They're falling faster than before. Now, the chief medical officer told us weeks ago that you'd first see the effect of the vaccine in fewer people dying and then in reduced hospitalizations. And I believe that that is exactly what is happening. What this all shows is that the link from cases to hospitalizations and then to deaths that had been unbreakable before the vaccine, that link is now breaking. The vaccine is protecting the NHS and saving lives, and right across the country's plan is working. As well as this real-world data, I want to share the results of a study by the University of Bristol, which clearly shows the difference the vaccination program is making. This study looked at all patients over 80 who were admitted with serious respiratory disease in Bristol. And the results showed that a single dose of both the Pfizer or the Oxford AstraZeneca jab offers around 80% protection against hospitalization after at least 2 weeks, even amongst the most frail and those with underlying medical conditions. Again, as with the data on this that were published last week, the effect was slightly stronger in the Oxford jab than with Pfizer. And what this corroborates is what we have seen over the past couple of weeks, the hard evidence that vaccines work. They're the best way of securing our freedom because they're the best way of protecting us. As of midnight last night, 21.3 million people had been vaccinated. And I can tell you for the first time that we have vaccinated now 2/5 of the entire adult population of the United Kingdom. Yesterday, I was in Scotland seeing the combined teamwork of NHS Scotland and Scottish local authorities and the armed forces delivering jabs in Hamilton. And they were all working together as one towards a common goal of protecting us all. And as anybody who's been to a vaccination centre will know, the joy on people's faces as they get the jab is unbelievably uplifting. And more people will be getting this feeling of protection over the next few weeks and months. We're on course to hit our target of offering a first dose to everyone who's over 50 or part of an at-risk group by the 15th of April and all adults by the end of July. The vaccine rollout has allowed us to set out our roadmap for how we'll carefully lift some of the restrictions that we've all endured for far too long. And as we do this, we'll be drawing on the huge testing infrastructure that's now in place. And I just want to spend a moment on this. We're now testing 2.8 million people a week. The roadmap is built on the principle of replacing the protection that comes from lockdown with the protection that comes from vaccines and regular testing. So as we open up, for instance, care homes, as I mentioned a moment ago, to visitors, that will come with regular testing for visitors. And as schools and colleges return, we'll be giving teachers, staff, parents, secondary and college students and their households access to rapid, regular testing, twice a week, in term time and in holidays. And I urge all those and the households of those who are going back to school or to college next week to take up this offer. One of the most dangerous things about this virus, one of the most dangerous things is that around a third of those who get it don't get any symptoms at all and yet can still pass the disease on to others. That's why it's so important that all of us follow the social distancing and take the precautions that we know we must. Rapid, regular testing is a critical part of our response. And as we do so much more, we can do more because of the huge capacity built up by NHS Test and Trace. So I would urge you, if you're eligible, to participate in one of these regular testing programs, like I do, because that is how we will keep this virus under control as we continue to roll out the vaccine. For more information, go to gov.uk/coronavirus. And I'd urge everybody who's eligible to get that regular testing. Now, I know also that this pandemic has been an anxious time for so many young people, and I just want to spend a moment on this. After all, growing up is tough enough even at the best of times. So in these very difficult times, it's been even tougher. Homeschooling, being unable to meet up with friends, not having regular sport, being stuck at home. I know just how much people are looking forward to going back to school, to seeing friends in a classroom properly, rather than just on Zoom. Monday will be a long-awaited day for many people. But for some, it's also a moment of unease and anxiety. We need to make sure we get the help to young people to help them get through this and get life going again and give them the support that they need. We've worked hard throughout the pandemic to make sure mental health services stay open. We've set up 24/7 support for those in need. And I'm delighted to be able to announce today that we'll be allocating an extra £79 million to boost mental health support for children and young people. Almost 3 million people will benefit from more mental health support teams, children and young people. And those mental health support teams in schools will be working hard to ensure people get access to the support and care that they need. And we'll be expanding access to mental health services in the community too. I'd like to end with some good news on our work to tackle new variants. Thanks to the brilliant team who've been working so hard over the past week, we've now successfully identified the 6th case of the variant of concern first identified in Manaus in Brazil. Using the latest technology and with the dogged determination of our testing and tracing scheme, we've successfully identified the person in question. The best evidence is that this person in question stayed at home and there's no sign that there's been any onward transmission. But as a precaution, we're putting more testing in Croydon, where they live, to minimize the risk of spread. This positive outcome was only possible because of the huge genomic sequencing capacity that we now have in this country and because of our test and trace team. So they could identify these cases, track them down, contact them. And it shows the importance of this capability that we've built and how important it is also to be transparent when new variants are found. Because whether it's here at home or around the world, testing, sequencing, and being transparent about what you find helps stop the spread of this disease. And in particular, these variants of concern that are so worrying. So I'm really, really delighted that the team have done this work. They've worked absolutely flat out since these 6 cases were first identified on Friday and found the 6 positive cases, even though the form wasn't filled in quite right. So Susan's going to say a little bit more about this in a moment, but my summary is that these things are moving in the right direction. These are challenging times. But thanks to the vaccine, we're making progress. We're not there yet. So as we go down the road to recovery, it's vital everybody still plays their part, follows the rules, and of course, when the call comes, get your jab. Dr. Hopkins.
Thank you. So I'm giving you a little bit more detail on what we've done for the investigation to find the individual in question. On Friday, the 26th of February, we identified 3 cases in England of P1, the variant first described in Manaus, Brazil. As we know now, one of the individuals had attempted to register his test online, but had failed to do so effectively. Specialist teams from NHS Test and Trace and Public Health England immediately launched an investigation to identify the individual concerned. An incident team of 40 people from across the system, made up of laboratories, logistics, data analytics experts, was mobilized to trace the individual. The team began with very little information. As of Sunday morning, they had a single barcode and a date and time the test was processed at the Cambridge Lighthouse Laboratory. Using the barcode data, they established that it was delivered through the DHL service for home deliveries. The Test and Trace deliver many thousands of kits across the week to the UK. And now they were looking at sequentially when this test was delivered and where this was delivered to, comparing it to other tests that were in the system. They worked backwards from when it arrived in the laboratory to where they had come, which testing hub it had come from, and backwards through the postal service. The intelligence was then overlaid with the geographical spread to look for the correlation of sequential barcodes. and the regions it had been distributed to. This narrowed it down to 2 regions and 10,000 possible households. Once the team had combined the region and the time window, experts tracked down every single distribution centre and then filtered it down further, down to 379 households. At this point, enhanced contact tracing kicked in, with call handlers calling, emailing, and phoning all of the individuals that could have received a test in that time interval. These calls narrowed it down to 27 individuals who received further calls, further texts, further messages. And on Wednesday at 3 p.m, an individual phoned the 119 service. They were able to give the missing barcode number that they had held securely for the whole time. This individual has been interviewed extensively and lives within a household that had recently returned from Brazil and all had quarantined at home. Further precautionary testing will occur in the neighbourhood, and we've already started testing all of the samples from the neighbourhood through whole genome sequencing to ensure that there's no further distribution of cases in the community. This is a testament to the NHS test and trace teams, the call handlers, and the Public Health England Health Protection team working together to find an individual and prevent further transmission. Thank you.
Thanks very much, Susan. First, we're going to go to questions from the public and then from the media. The first question by video is from Andrew from Durham.
What will the government be doing around the current mental health challenges? How will they be approaching mental health and well-being for the future, especially mental health and well-being in young children in schools? Thank you.
Well, Andrew, it's a very pertinent question because it's an incredibly important challenge. And it's clear that the measures that we've had to take in the last year and the lockdown have had a significant effect on some people. And we need to make sure that we respond to that and support our mental health professionals who've been working incredibly hard. And I would say that the response is in 3 parts. The first is to support those who are currently working very hard to deliver mental health services. And in particular, we've seen a rise in presentations of serious mental ill health, and making sure that our mental health teams have the support to respond to those cases in a timely fashion is incredibly important. The second has been to expand the number of people who can get access to mental health services to support those who may have a challenge with their mental health, which can be addressed through services like talking therapies, so-called IAP therapies, and other online services, which we've expanded massively during the pandemic. And the third is something that we've announced further funding to today, an extra 79 million to support children and young people's mental health, especially as they go back to school. And this will be linked support workers who link schools with local mental health services, because it's not just about the serious mental ill health, although that is obviously absolutely critical. It's about making sure that everybody gets the support to strengthen their mental health. And this is something everybody can do in the same way that, even fit and healthy people go out to strengthen their physical health. I was out running in the park this morning. Everybody can take steps to support their mental health and to make sure that your mental health stays strong. And there's a range of tools available, from the Every Mind Matters tool, which Public Health England have developed, which is excellent, all the way through to the array of NHS mental health services that are available. And we've put in the extra money to make sure that there is that link between children and young people who have challenges with their mental health, who present at school, making sure they can then get access to services so that services are accessible to them. So thank you very much for the question, very timely. And I hope that I've given a full answer. The next question is from Hannah from Cornwall.
In order to allow shielding teenagers the chance to return to school with their peers, has the government considered widening the criteria for which under 16s are eligible for the vaccine?
Thank you very much, Hannah. I'm going to ask Dr. Hopkins to set out more details because the clinical details are what matters here. But if a child's clinician judges that because of their condition, it is appropriate for them to get the vaccine, that is allowed within the rules. That is, but it has to be down to the judgment of an individual clinician.
Yes, so just to add, so JCVI, as you know, have recommended that 16 to 18-year-olds who are in the clinically extremely vulnerable group can be offered the vaccine. And in groups under that age group, it really is a decision for the general practitioner or the specialist in charge of that child's care. We have very little data for children yet, and further data will come through from both studies in children and our monitoring process for any child who's given a vaccine. But this really is an important decision that needs to be driven by the experts involved in the child's care.
Thanks, Hannah. That's a very important question. And the critical thing is it is allowed where the child's clinician thinks it's in their best interests. The next question is from Vicky Young at the BBC.
Health Secretary, you stood at that podium in May last year and said that nursing deserved fair reward. Is a 1% rise fair? And secondly, we've been hearing a lot about vaccine hesitancy in some places. Do you think that it's now there's a case for mandatory vaccination of NHS staff?
Thanks very much, Vicky. Well, I pay tribute again to the incredible work of all those who are working in the NHS, especially over the last few months during this second peak. And it's been incredible. As I said in my opening remarks, these have been challenging times. And one of the challenges that we face as a country is in terms of the financial consequences of the pandemic. And so the evidence that was put forward yesterday was on the basis of affordability. Now, of course, elsewhere in the public sector, there's a pay freeze in place. And we've proposed what we think is affordable to make sure that in the NHS, people do get a pay rise. And I think it is fair to take into account all of the considerations, the incredible hard work of those in the NHS, which means that they are not part of the overall public sector pay freeze, and also what's affordable as a nation. And that's the basis on which we've taken the decision. When it comes to vaccination, obviously, I'd urge everybody in the NHS to get the vaccine. And we have seen the take-up increase. I would like to continue to pursue that because I think that is the best way to ensure that we get as high coverage as we can without having to bring in a mandatory vaccination. We are not going to bring in mandatory vaccination across the board. And at this stage, we are not proposing to bring in mandatory vaccination for NHS staff. But as you know, there is a review into these questions that's being led by my friend, the Chancellor of the Duchy of Lancaster. And it will look into the moral, ethical, and practical questions about all of these issues. Thanks very much, Vicky. Libby Vina at ITV.
Good afternoon, Health Secretary. There are still 12,000 people being treated for COVID in hospital that you've mentioned. How hard did you fight for a more generous pay offer for those who are looking after them? And how hard are you prepared to continue to fight for those NHS workers? And can I ask Dr. Hopkins, how effective do you believe the AstraZeneca vaccine is against the Brazilian variant?
Well, Libby, as you know, I am a huge admirer of all those who've worked in the NHS during this pandemic and done so much. And I'm very pleased that the NHS staff have been carved out of the pay freeze. We do have issues of the affordability because of the consequences of the pandemic on the public finances, which were set out in the budget this week. And we have to take those into account, but we have been able to carve out the NHS from the pay freeze that applies to everybody else in the public sector. And I'll hand over to Dr. Hopkins for the second question.
Thank you. So from the point of view of AstraZeneca, we do not yet have laboratory or clinical data to show the vaccine effectiveness or neutralization studies for the P1 variant from Brazil. However, as you know, we have some data from B1351, the variant that first emerged in South Africa, and we expect that it should at least perform in a similar way. And therefore that we think that it's likely that there may be some reduction in risk of transmission or reducing the risk of transmission. But we at least hope at the moment that it will have a strong impact in reducing hospitalizations and deaths. We do need to wait for studies to come out from South America and in particular Brazil, and those will come, but it will take weeks rather than days, I'm afraid.
Thanks very much. Next question is Ashish Joshi from Sky.
Good afternoon, Health Secretary. Good afternoon, Dr. Hopkins. Health Secretary, there'll be people at home who've just listened to what you've said and will be incredulous at the language you've used, this brilliant success of taking a week to find one individual. What does that say about our test and trace system a year on into the pandemic? And Dr. Hopkins, how helpful would it be to you and your colleagues if we closed our borders now?
On the first question, I think it's an absolute tribute to the team at NHS Test and Trace and Public Health England and all those who've been involved in this search, that despite the fact that this case was one of the very, very few where the correct details weren't attached to the test itself, which happens in 99.9% of cases, that despite the fact it was in that 0.1% where that doesn't happen, they managed to track down this individual. And I think it's reassuring that all the evidence shows that that individual and all 6, 3 in Scotland, 3 in England, that we have where we found this variant of concern, followed the rules. And we obviously have put in the testing around that. And the final point I'd make on this before handing over to Dr. Hopkins is we wouldn't know about any of this without the huge testing capacity and the sequencing capacity. You know, we sequence just under half of all these genetic sequences in the world in this country because of that capacity that we've built. And in fact, I was in Glasgow yesterday, I was seeing the expansion of that sequencing, which we're putting in place to increase it further. It's only because of that capacity that we were able to find these 6. In most other countries in the world, we simply wouldn't have known that that had happened. And therefore, we were able to track all 6 down. Dr. Hopkins.
Thank you. So I think the challenge about borders is that people coming into this country at the moment and leaving should only be doing it for essential reasons. And as you know, only people who have a British residency or a British passport can come in from many countries right now. In addition, the day 2 and the day 8 tests while people are in quarantine give us extra reassurance of being able to detect cases. And we are also whole genome sequencing any of those that can be sequenced. All of that is really positive because it allows us to find any of these variants coming into the country earlier, trace any of their contacts, trace people on flights as we did for the previous cases. And that gives us a lot of reassurance that even with small numbers of individuals coming into the country, that we can minimize the risk to the public health and to the population.
Thanks very much. Next question, Nigel Morris from the Eye. Nigel.
Secretary of State, the PM said all the way back in July 2019 that the government had a ready-made plan for fixing the long-running crisis in social care funding. And yet his press secretary said yesterday that you still had no detailed proposals on the issue. Could you finally give us a firm date when your social care reform plans will be produced and update us on what cross-party contacts have taken place following your call for cross-party consensus on the issue? And secondly, very quickly, could I ask, was consideration given to a one-off bonus to NHS staff as is happening in Scotland? And if so, why was the idea rejected?
Well, thanks very much. The obviously solving the social care funding issue has been a long-standing problem. We have a clear manifesto commitment to deliver on that, and we intend to publish details of how we plan to do that this year. I've been working with the Prime Minister on it. Clearly, before the pandemic, we were starting to work immediately after the election on this. We did engage then in cross-party engagement. I put out a call, as you mentioned, for cross-party suggestions and input. We received quite a lot of that, and that's been part of our considerations. And I hope that we can come forward with a plan that can work and can carry public broad consensus. Now, it is more challenging to deliver this in more difficult economic times. That is obvious and clear. What we need to do, though, is put in place a long-term plan that will bring about a solution to this problem. At the same time, there are many, many other improvements to the delivery of social care that we can make, as well as addressing this issue of the funding reform. And many of those are contained in the white paper that I set out last month, on which there'll be a bill in due course, to bring an integration between health and social care formally, and much more so than we've had until now, because that is part of the solution to this significant problem. Even that part of the solution, the integration of health and social care, is an issue that's eluded governments of all stripes over many, many years. And I'm absolutely delighted to have been able to set out that white paper and to bring forward the bill in due course. On the second part of you, I've completely forgotten your second question. I should have written it down. Sorry.
One-off bonus for Scots.
Oh yes, the administration in Edinburgh take their decisions in terms of how they run the NHS. That isn't the approach that we have chosen to take here. And obviously, the matters of pay will go to the pay review body, but we have set out what is affordable given the very significant challenges to the public finances. Next question is John Johnson from Politics Home.
Good afternoon, Health Secretary. Two quick questions, if I may. Earlier today, the Scottish Conservative leader, Douglas Ross, said that test and trace in the early stages of the pandemic did not work as well as it should have, and that he believed government ministers would accept that. Do you accept that analysis? And if not, why not? And secondly, Conservative MPs, including the chair of the Education Select Committee, have called for further evidence to be published over the weekend regarding the use of face masks in schools. Do you have any plans to explain to parents and teachers why that guidance has been issued, to reassure them that when pupils go back on Monday, that they're making the right decision by asking children to wear face masks?
Thanks, John. On that second question, I'm going to ask Susan to give a clinical answer. On the first question, of course, at the start of this pandemic, test and trace didn't exist. We developed the first test. Public Health England did that, and they did it within about a month of first discovering about this virus in the first place. So, of course, there's been a program of constant improvement, and it's testament to that improvement that we now have turnaround times of under 24 hours in the vast majority of tests right across the UK. We have this huge sequencing capacity, which is the biggest in the world as a proportion of our population by a huge margin. We have contact tracing that reaches over 90% of positive cases and over 90% of their contacts, and again, very, very rapid speeds, which is an incredible achievement of the team to have built all of this. It means that we are in a better place to deal with a pandemic like this than before. And it's been because we've built it all the way through. That's been a very important part of what we've had to do. And I've spoken at this podium many times about the work that's gone on to make all of that happen. Susan.
Thank you. So our face coverings and face mask group have reviewed the evidence and also looked at the variant that we have circulating, B117. It was with that variant and with the increased transmissions that we were seeing around the school environment, not just in the school, but on the way to school, especially in secondary schools, that the advice for secondary school children to wear masks in the classroom and in corridors whilst moving around the school came as part of the advice package to reduce the risk in secondary schools on the return of March the 8th. That goes hand in hand with the testing that we're advising schools to do to also reduce the risk, along with all of the other measures the schools have put into play. And this is all there to reduce the risk of transmission in schools, to allow our children to continue their education safely, and to ensure that we have the least amount of rises that we can possibly hope for, with increased mixing around return to schools next week.
Thanks very much, Susan. Final question, Megan Ford from the Nursing Times.
Good evening. Nurses are considering industrial action, and others may quit altogether following the news that they might receive just a 1% pay rise after a year of COVID-19. So my question is, how do you expect to stabilise the NHS and complete the vaccination programme without nurses on the ground?
Well, Megan, it's an incredibly important point that we need more nurses. Not just the nurses that we have now, and we have a clear manifesto commitment to 50,000 more nurses in the NHS, and I'm delighted that there's more than 10,000 more nurses who've joined the NHS over the last 12 months. Also, we've seen an increase in 34%, so more than a third, in the applications to nursing. And of course, over the past 3 years, nurses have had a 12% pay rise. And I bow to nobody in my admiration for nurses. In fact, I learned that at the knee of my grandmother, who was a nurse and worked nights at the Pilgrim Hospital in Boston. The challenge is that the nation's finances are tight, and whilst everybody else in the public sector is going to have a pay freeze, we are able to give to propose a pay rise for nurses at 1%. I entirely appreciate that reflects the difficult financial circumstances that the country is in. But what I'd say to every nurse who's watching and everybody who has worked so hard is we have, over this pandemic, pulled together in an incredible way. And I really hope that we can continue doing that, both to deliver for patients and also to support our NHS and to welcome many, many more nurses into the NHS over the years ahead. Thanks very much, Megan, and thanks to all. That ends today's coronavirus briefing.